Isang magandang mapagpalayang umaga Luzon, Visayas at Mindanao. Magandang araw po sa lahat ng mga kababayan natin nakamonitor sa iba't ibang panig ng mundo. Welcome po sa Thank You. This one is a taped episode. Huwag kayong magtaka, baka magtanong kayo. Hindi namin maitanong sa doktor. Ano po, pasensya na. From time to time, nagtitape episode po tayo. Si Alvin Elchico po ito. Siyempre, hindi kompleto ang programa kung wala si Ate B. Ate B, Bernadette Sembrano-Aguinaldo. Ate B, good morning.
Good morning, Vinsky, at magandang umaga po sa inyo mga kapamilya. Ito pong topic na ito na di-discuss natin, very close to my heart din dahil relate ako. Okay, yun naman yung totoo. Actually, hirap mabuntis. Ayan po. Hindi lang po ito issue ng babae, issue po ito ng mag-asawa pala, no? Kapag sinabing hirap makabuo ng anak. Bakit nga ba tayo nagkakaproblema? Pero tamang-tama, meron pong makakatulong sa atin. Kailangan po kasi pinag-uusapan natin ito. Ito po, makakasama natin ang kaibigan po natin, OB-GYN, UP College of Medicine, Philippine General Hospital Department of OB-GYN, former professor, former chief din siya ng Division of Reproductive Endocrinology and Infertility, past president din po siya ng Philippine Society of Reproductive Medicine, at current VP din ng Philippine Society for Fertility Preservation, Assistant General Secretary General ng International Federation of Fertility Societies 2022 hanggang 2025. Eksperto po sa madaling salita. Dr. Eileen Manalo, magandang umaga po sa inyo, Doc.
Good morning, Bernadette. Good morning, Alvin. Magandang umaga po sa inyong lahat.
Ang pag-usapan po natin, yes, Doc. Yes, Doc. Ang pag-usapan po natin hindi lang doon sa difficulty in getting pregnant, but the overall reproductive health, damay na rin natin. Nung kababaihan, siguro pati kalalakihan na rin, matouch natin kahit papaano. Ano po? Bakit nga ba nahihirapan magbuntis ang ibang couples, Doc? At yung iba naman, napakabilis namang mabuntis. Go, Doc.
Well, first of all, ang tao, hindi masyado namang fertile to start with. A couple who's supposed to be very normal, meaning to say, nangingitlog yung babae, buwan-buwan, at walang diferensya ang matres niya, walang diferensya ang kwelyo niyang matres, pati yung pelvis niya. Ang lalaki, maganda yung similya, maganda yung galaw, maganda yung itsura ng similya, at hindi siya mabagal gumalaw. So in other words, perfectly normal as far as reproduction is concerned. The chance of getting pregnant, we call it fecundability, is only 20%. So in other words, out of 100 couples trying to get pregnant within the same month, only 20 will get pregnant. And within, like say in 1 year, 85% of supposedly normal couples will get pregnant. So that's what we call the fecundity rate, no? Or the cumulative pregnancy rate is 85%. Meaning to say, yung 15% ang hindi magbubuntis, no? So, kaya ito yung tinatawag nating infertility rate. So pag sinabing infertile, hindi ibig sabihin baog. Ibig sabihin lang to, nahihirapan silang magbuntis, they are regularly having sexual intercourse, wala silang ginagamit na contraception or family planning, walang condom, walang natural family planning, walang withdrawal, walang pills, and yet they're not achieving pregnancy. That's the 15% infertility rate. Okay?
So it's not something rare. Actually, hindi common actually siya na problema.
Yes, it is a common problem. A local study in the Philippines, about 10%, no? But overall, we say in the entire universe, it's about 15%. So many people come to us because they're having difficulty getting pregnant, no?
Hindi pala ganun kasimple. Oo. So, ang problema kapag sinabing hirap mabuntis, hindi lang babae ang tinitignan, pati sa lalaki. Parang ganun.
Yes, because it takes two, di ba? I mean, hindi ka naman pwede magbuntis on your own. So, maraming babae na ang ganda ng pangingitlog nila. They have regular menses, they're young. And yet, yung sa lalaki naman, meron akong isang pasyente na first time pa lang sila nagpatingin. And then at that very first consultation, we asked for semen analysis, walang sperm yung lalaki. So yun, no? So ito yung sinasabi natin nung araw na sterility, pero ngayon, because of assisted reproductive techniques, pwede na rin makabuntis yung mga lalaking supposedly walang similya. Pwede na rin magbuntis yung mga babaeng nawalan, say, ng fallopian tubes. Kasi, halimbawa, na damage because of infection o kaya nag-ectopic pregnancy, na-operahan sila, natanggal ang fallopian tubes. So, nung araw, they were considered baog or sterile. Ngayon, natutulungan na natin because we have assisted option. Yes.
Let's start from the beginning, Dr. Eileen. Simulan natin sa umpisa. No? May couple, halimbawa na nahihirapan. Anong tests na pagdadaanan muna? Kasi may eliminate muna tayo. Diba? Hindi pwedeng parang masyadong malawak yung net natin. May eliminate tayo dyan, Doc, di ba? So ano mga tests ang una muna, yung standard na tests na pagdadaanan ng couple who want to... Sige, Tibi, you were...
Or when do you start getting tested? Siguro ang tanong, kapag ba 2 years na kayong walang anak, ay baka may problema? Or ganun lang talaga? Sige, Doc.
That's a very good question. 1 year lang. 1 year lang na regular kayo nagko-contact, hindi pa nagbubuntis, magpatingin na. Tapos, kung halimbawa, yung lalaki, alam mo nang operahan ka na dati, may varicocele ka, tapos nasabi na sa'yo, mababa yung count mo, you're not gonna wait for 1 year. 6 months pa lang na nagsasama kayo, magpatingin na. Also, if you've been diagnosed with endometriosis, if you've been diagnosed with polycystic ovary syndrome, na alam mong hindi ka naman buwan-buwan nangingitlog, bakit ka mag-iintay ng 1 taon, 2 taon? So in other words, pag alam mo nang may diferensya, or if you're 35 years old, you know that the fertility of a woman drastically goes down when she reaches 35 and above, then you're not going to wait for 1 year. 6 months is sufficient for you to consult your fertility doctor.
So anong test yun, Doc? Anong test sa pagdadaanan ng...
Siyempre, importante, physical, history muna, no? So you check with, nagkasama ka talaga sila. Merong iba dyan kasi, married to a seaman, nagkikita lang 1 month every year. So it's very hard to establish infertility there. But nevertheless, there should be some pregnancy if they've been, he's been coming back and forth to the Philippines. And so you're not gonna wait for, say, 12 months na talagang ika-count mo yung time na together. So sisimulan mo yung sinilya ng asawa. That means 2 to 3 days of sexual abstinence bago mo siya mapagawa. Hindi naman pwedeng ka-ejaculate lang niya tapos papa-examine mo kasi bababa syempre yung count ng lalaki. So semen analysis, and then the history is very important. As I said, it's a really regular contact. Some will say, we've been married for you, but they have really been cohabiting. Matagal na sila nagsasama, 10 years. Ito talaga dapat matagal na nagpatingin. So ang tagal na ng infertility nila. So you have to establish kung nangingitlog ba yung babae. You will do your physical examination. Titingnan mo syempre yung buong pagkatao ng tao. Hindi mo naman titingnan lang yung mattress niya at saka kwelyo, kaya yung ovaryo niya. Yun. So, yung initial examination, complete examination, ipapap smear mo siya, you check for infections, you check for even cancers, you do your ultrasound to find out if there's anything wrong with the uterus, the ovaries, yan. Tapos, may mga lab tests kang gagawin. So, the labs will also depend kung ano yung condition, kung ano sa palagay mong diferensya ng tao. Like, if you know that she has polycystic ovary syndrome, checkin mo yung mga hormones niya, you want to correct those hormones, you want to give her fertility drugs. If she is more than 35 years old, if she's had operation in the ovaries, if she's had chemotherapy, radiotherapy, or some treatment for cancer, you want to see if she has the possibility even of producing eggs. Kasi pwedeng na-damage na yung ovarian supply niya. No? So pwedeng hindi na nga siya nagpo-produce ng eggs. The age, in fact, if there's anything that you should consider, it is the age of the woman which is the most important. No? So we give patients, meron kung dadating sa'yo, 51 years old, Doc, gusto ko pa ho kasi na pang-asawa ko ngayon, 35 years old, gusto namin magkaanak. 51, di ba, is the universal age for menopause. So, titingnan mo pa rin. I mean, you're not gonna say, well, it's impossible, wala na, hopeless ka na. Titingnan mo pa rin yung ovarian supply niya. We check the anti-Müllerian hormone or the antral follicle count. Those are 2 ways. The antral follicle count is by ultrasound. The anti-Müllerian hormone is a blood test that will tell you, meron pa ba siyang chance ang magbuntis by producing eggs, no? So, kung medyo okay pa yung number, ang normal is 1 to 4 na nanograms. So kung more or less normal pa yun, susubukan mo pa rin, no matter what, no? And at the end of the day, at the end of the day, also people who have no ovarian function, there's also egg donation, di ba?
Yes.
Doc, country.
We're getting ahead of ourselves. I-discuss natin yung mga donation din. Masyadong mabilis, no? Masyadong, kasi gaway na dito, okay? From the perspective ng lalaki, so i-discuss ko yun sa lalaki, si Ate B sa babae, it's easier said than done. Kasi may epekto siya sa psyche na parang, ba't mo ako pinapagawa na sa katerbang test? Ano yung sabihin na hindi ako makabuntis? So may epekto siya sa psyche ng lalaki. Lalo pa nga ang mga lalaki, hindi yan mahilig magpa-check up at ayaw nila ng binubuting-ting. Yung kanilang, by nature, hindi ho ba, ano po?
I totally
So,
agree with you, Alvin. Yeah.
correct.
I've had patients wherein we've been examining the woman and then making her ovulate on a regular basis. And kinukulit ko, this is when I was, starting my practice. Kinukulit ko, nasa yung similya ng husband mo, hindi ko pa nakikita. Pinapag-contact ko sila. Hindi kami nag-inseminate pa at that time, no? Tapos, wala, it just went on. And then it's been like 10 months only to find out, finally, the guy consents, wala palang similya. So, wala palang spermia. So, we've been doing nothing. We've been wasting our time and we've been wasting her money and her time to try to achieve pregnancy. So, actually, yeah. So, I've had patients na napabuntis na, nanganak na. And then they want to try again. But sometimes it's the husband who is resistant, no? Especially when they know problem is with them. Pag alam nila yung mababa yung similya, pag mababa yung morphology, kasi out of 100 sperms, 4 would have to be normal. Imagine, 4 lang ang kailangan, pero yung iba, 1% lang normal, 2% normal. So, maka-fertilize ang ganong sperm or you end up with miscarriages, no? Hindi rin nabubuo. Yun.
No, rewind ako ulit. Masyadong mabilis.
Okay.
Dandan. Yung similya na sinasabi mo, pwede kasi na merong i-ejaculate. Ano po, ito for scientific purposes naman po ito. Ano po? Pwedeng may lumalabas na sperm, na semen. Kasi nag-ejaculate naman, di ba? Pero hindi ibig sabihin na pag may lumabas na semen, may similya, hindi siya pareho. Kahit sa katerbang lumabas na semen, pwedeng patay o walang similya doon. Tama ba?
Correct. So, merong iba na may similya. Siyempre, may similya. May fluid yan di ba? Tapos, pero pag tinignan mo pala, yung pala, walang sperm. Okay, maybe 1 or 2 sperms, minsan patay pa. So, yun.
Yes. So, how do you do that? How do you check? Kasi, alimbawa, kami mga lalaki, ayaw namin na parang kasama mo yung misis mo, yung partner mo, nakakababa ng pagkalalaki kapag chine-check ang similya. Di ba may ganong impact sa kanya How do you then measure na meron namang konting discreet naman na kayo lang dalawa o tayong dalawa lang mag-usap muna. Huwag muna yung misis, huwag muna yung partner. Paano yun? Paano ko measure na ang semen na lumabas sa akin ay may healthy sperm?
Okay. So yun, we have to do the semen analysis and ideally, the room should be quiet. It should be conducive. No, I mean, there are some men, of course, who would easily get it up with their wives, pero pag pinapunta mo sa isang kwarto, hindi sila makaproduce, di ba? So sometimes, syempre, you have to ask the wife to tulungan sila. So parang pa rin, may foreplay pa rin doon so that he can produce the sperm. Okay, so that's one. Number 2, there are 2 ways by which a man will have no sperm. Either there is obstruction, so hindi makadaan yung similya, may nagpo-produce siya pero hindi makalabas, no? Kasi due to some ejaculatory problem, some anatomical problem, or he could have had some infection, so na nagbara yung daanan ng similya, or it could be a problem with production, parang menopause ng babae. So yung iba talagang wala na, miski bata sila, maybe from some childhood disease, maybe from tawag dito mumps, no? Mumps orchitis, no? Nung nagbibinata sila.
Pwede rin pala talaga yun.
Pwedeng makadestroy ng testicular function. So yun, kaya ititingnan mo yun. Na ang maganda kasi ngayon, may test tayo. So meron tayong fructose test to find out. So if in the semen analysis, there's release of fructose, then that means there is no obstruction. Also, you can check the hormones, no? Pag ang lalaki, mataas na masyado yung FSH and LH, no? Then, ibig sabihin, testicular failure na yan. So, halimbawa mo, walang similya, okay, mababa yung count, tapos mataas yung FSH and LH. Parang sa babae, pag menopause na tayo, mataas yung FSH and LH natin. Ibig sabihin, menopause na yon. So, medyo sa lalaki, testicular failure ang tawag doon.
Sige, sa babae naman.
Yung trauma, pwede bang makakos ng pagkabaog sa lalaki? Pag natamaan yung kanilang, di ba ganun yun? Pwede rin talaga.
Trauma can do it, of course. Infection can do it. No, even the COVID now, pagka nag-COVID ang lalaki, hindi nga natin pwedeng magamit yung similya for 3 months. If you check the semen parameters, they're all abnormal. And so, remember that spermatogenesis takes 71 to 90 days. So, hindi mo muna gamitin yung sperm na yan. And then you allow them to get better. So, you can do the fertility management after 3 months has elapsed. So, that's now
Wow,
what...
pati COVID ngayon may epekto, Doc,
COVID,
sa
yes.
sperm na-approven na ba yun? Na may epekto yung
Oo,
COVID?
it affects
Wow.
the sexual function, yes. More than
Ate
female functioning.
Sa
Reproductive.
babae naman, Ate B, yung
Sige.
concern.
Anong mga test, Doc, ang gagawin naman sa mga babae? Ang mga basic na alam ko, na at least nasubukan ko, transvaginal ultrasound.
Well, the transvaginal ultrasound, syempre, will tell you kung mayroong mga bukol ba dyan, kung mayroong may mga myoma, adenomyosis, mga polyp, that can prevent the entry of the sperm, that can prevent the implantation of the baby. You can have myomas, but you don't necessarily have to have surgery kung wala namang obstruction sa pagkapit ng baby. Okay, so yun. And then it will also tell you if you have polycystic ovary syndrome. So the syndrome consists of 3 components. You have irregular menstruation, you have signs of androgen excess. Androgen is the male hormone, so it will manifest with oiliness of the skin, pimples, and then hairiness. So yun. So androgen excess, and then the polycystic looking ovary. So marami kang maliliit na follicles, 2 to 9 millimeters. Now they will have to be 20 per ovary. So yun. So you have 3 components, but you only need to satisfy 2 out of the 3. So like say you do an ultrasound and you see polycystic looking ovaries, you have to establish that there is at least androgen excess or irregularity of the menstruation. Kasi pag polycystic ovaries lang, it doesn't mean you have the syndrome. Okay? So yun, that's why. So transvaginal ultrasound, establishing if there's ovulation. Makita mo naman kung regular yung menstruation. At saka tayo kasi madali yung access natin sa ultrasound, monitor natin yung patients. So, lalo na bigyan mo ng fertility drugs yung pasyente, you start the fertility drugs on days 3 to 7 of the cycle, and then you see the patient on day 10, you monitor for the sign of follicular growth, o sabi mo, yan, nagiging fertile ka na, mag-contact na kayo. Kung ang problem lang naman sa ovulation, madali yan. Kung bata yung couple, tapos wala namang ibang problema sa lalaki, you don't even have to do insemination.
Ayun. Doc, so yung intervention ng sinasabi natin, parang yung unang basic, kapag walang problema yung mag-asawa, both are healthy, timing lang. Magbibilang lang si babae kung kailan siya fertile. Siguro si lalaki may ganun din.
So, in patients who are young, tapos 1 year pa lang sila namang kasal, wala ka namang na-establish ng mga major problems, then you can do timed intercourse. Pero in patients na medyo mababa yung count, o kaya medyo matanda na rin yung babae, medyo matagal na rin yung kanilang pagsasama na wala pa ring baby, you have to be a little bit more aggressive. So, hindi na timed intercourse na yan. Also, if there's like endometriosis, pag nagre-regla ang babae, nagre-regla rin sa pelvis, and this causes a reduction in the fertility of the woman. So again, tutulungan mo na yan with insemination na yan. Okay? So what else is your question? Sorry.
Yun,
Ano yung problema
intervention.
pag intervention? Sige.
Oo, yung insemination,
Intervention daw muna,
anong ginagawa? Kasi parang, sige, kasi Doc, ano yung insemination? Baka hindi pa alam ng ibang mga kababayan natin. Anong ginagawa doon?
Okay. In insemination, kukunin yung similya ng lalaki, tapos ipaprocess yon ng andrologist, no? So usually may IVF laboratory, so meron tayong andrology lab, sila yung nagpa-process ng similya. They do the swim-up technique, so kukunin nila yung most motile sperms, and then syempre, i-collect nila yon, tapos yun ang gagamitin na ilalagay sa loob sa uterus ng babae at the time that she is most fertile. So we put it inside, so there's a proper timing for it, no? Okay, so you don't
Pero
just...
yung boyfriend o yung asawa mag-ejaculate muna para may sperm, or ang sperm donor yun?
Ay, hindi. Bawal kasi tayo ng egg donation, bawal tayo ng sperm donation.
In the Philippines.
Okay.
In the Philippines.
So ang mister niya o yung partner niya mag-ejaculate, kunin yung semilya, ipipreserve, i-inseminate sa uterus.
Hindi siya pinupreserve. Kinukuha siya. Okay,
Fresh.
kinukuha siya, tapos you process it so you get the most motile sperms. So actually, mga 0.4 cc lang ng ang nakuha mo yun kasi talagang sperm concentrate yun, ilalagay mo sa loob ng uterus. And it has to be timed at the time that you are, the patient is ovulating. So there's a timing for that. You monitor the response of the patient to your fertility drug, And when you see a follicle, which is 18 millimeters, when you see a lining of the uterus, which is 8 to 10 millimeters, you know that she's most fertile. And then you give her a medication, we call it the trigger, for her to release the egg. And 36 hours later, that's the time you time the insemination. So that actually will give you maybe a 20% pregnancy rate. It's never going to be 100% pregnancy rate. What it does is it mimics the normal fecundity rate. Okay?
Yeah. So which means dapat nag-uusap din talaga yung lalaki at saka yung babae. Kasi timing pala is very crucial. We're talking of time.
Of course, yes. So, like in timed intercourse, you know that the egg is going to be released in a matter of hours or like say, if you do the trigger in 36 hours, so talagang pinapakontin na siya today, tomorrow, the following day. That's for timed intercourse.
Eto naman. Kasi hindi naman lahat may budget. Meron bang mga mapapansin si babae sa katawan niya? Kunwari wala pa silang problema, within 1 year pa naman. Uy, nag-tender na yung boobs ko. How do you know you're fertile na? Uy, talaga na asawa, let's do it para makabuo ng baby. Ano yung
that's a very good question, Bernadette. No? So, in a woman who is regularly menstruating, so she's like getting her period every 28 days, every 30 days, then you know that she will be fertile during the mid-cycle. So, kung bawa, 28-day cycle, day 14 yon. Kung 30-day cycle, that's day 16. Makikita mo pati na aside from yung premenstrual muliminas, masakit ang boobs, tapos medyo may mood swing siya, makikita mo na merong mucus na lumalabas. No? So, yung cervical mucus, which is stretchable, so that means that's due to estrogen effect and you know that she's beginning to be fertile. And so you can tell her, oh, yun, mag-contact na kayo. And if you do the ultrasound, you will see that this is the time that the lining is very thick, 3-layered, 8 to 10 millimeters. You can even see fluid in the cervix. Then you can see a nice big follicle which is ready to release the egg. So that's the time that she's most fertile.
Si lalaki,
yung lalaki ba, yung lalaki may timing din? O yung babae lang ang may timing issues?
Oo wala kasi talaga yung timing. Alam mo, ang hirap nga sa lalaki kasi yung what do you call this? Sex on demand can be very, very difficult, no? So even if the guy is very fertile and very virile, and he's so much in love with his wife, if you tell him to have sex on a daily basis, nahihirapan pa rin yan. So sometimes we have to give them mga sildenafil just to maintain the erection if you have to do it on a regular basis. Which is why in practice, if it's just time intercourse, you can have them have contact every other day at the time that she's supposed to be fertile. So mga days 10, 12, 14, 16 yan. Imbis na every day, kasi nga nahihirapan yung lalaki.
Okay.
So kung nabuo, di ba merong nabubuo, pero hindi nagtutuloy eh. Nabubuo, napo-form, pero hindi siya nagpo-progress. Ano problema doon?
Well, the number one reason why you don't end up with a viable pregnancy is it's not a normal baby. So yun, it's aneuploidy, okay? So the miscarriage rate is about 10% in the entire population, okay? So, and the number one reason for that is a chromosomal abnormality in the baby, which is an aneuploid. We are all euploids. The mere fact that you and I are looking normal is because you're 46XY, Alvin, Bernadette is 46XX, I'm 46XX. But an aneuploid embryo will have either 45 or 47, and they usually do not thrive. Hindi sila nagde-develop, kaya namamatay. Pero of course, meron pa rin, di ba, yung mga trisomy, minsan nabubuhay pa rin. They live long lives up to the 60s. Pero generally, yon, hindi sila natutuloy kasi hindi sila normal. And we tell our patients, it's God's way of getting rid of abnormal babies.
Yeah. Hindi ko sabihin, yung, di ba nagtatry kayong ganyan, di pa ulit-ulit, third time na, fourth time na, ganun pa rin. Do you try another method? Or try and try sa method na yan until na makabuo kayo at mabuntis at manganak si Mrs.?
I think that's a good question, no? Kasi in the Philippines, after one miscarriage, naghahanap na tayo ng immunologic cause, which shouldn't be really, because immunologic causes are looked into if you've had 2 or more miscarriages. So there's a term called recurrent pregnancy loss. And it's defined from the European point of view and the American point of view. So ESHRE is European Society of Human Reproduction and Embryology. ASRM is American Society for Reproductive Medicine. They say that you have to have at least 2 pregnancy losses. Sa Pilipinas, Hindi eh. One pregnancy loss, titingnan natin, apas, hindi ganun yun, no? So, immunologic causes, you have to have at least 2 pregnancy losses. So, if you've had one miscarriage, then think of it, maybe it could be so many factors. The number one being the baby's not normal, but it could still be other reasons, like if you have uncontrolled diabetes, if you've had uncontrolled medical problems like Graves' disease, or your husband has uncontrolled diabetes as well. So these are things that the doctor should look into to try to find out. So it's not as if you're just gonna do it again and again. Siyempre, hahanapan mo naman ng sakit, no? Kasi sabihin mo, the number one reason is a chromosomal abnormality. Sabi mo, ay nako, di ba, lang mag-sex na kayo, so susunod magbubuntis ka na. No, you still have to help them. But, you know, you don't go the full workup kasi mahal din yung workup. And you really have, kasi anong nangyayari, after that, na-diagnose sila sa immunologic, nininervous na sila. They think that they cannot have children and it shouldn't be. You know, I have a patient na, just last Saturday, my clinic was up to 4 o'clock and she got lost. She came all the way from Quezon City and she came at 5 and she was so scared because she had been diagnosed with so many immunologic problems, category 1, 3, 1, 2, and 5. I said, relax, you know, you've had one miscarriage. Just because we found these things, it doesn't mean no, you can't have a baby. We're just gonna help you. And yun lang, tatanggalin dapat natin yung fear sa couples kasi they're already stressed as it is. And they shouldn't be made to feel that it's impossible to achieve for them to achieve pregnancy.
Doc, buti nabanggit nyo, yung miscarriage kasi, mabigat yan sa mga couples po, no? Pero what you're also saying, normal rin pala na hindi natutuloy ang pagbubuntis.
Hindi siya normal, pero common siya. So,
Common.
1 out of every 10 pregnancies will end up in a miscarriage. In fact, if you look at the reproductive triangle, 60% of pregnancies are unnoticed. Hindi nga natin alam, nagbuntis pala tayo. No? Na-delay ng konti, hindi naman tayo nag-pregnancy test. Yung pala, may implantation failure na yon. So, out of the 40%, 25 will go on to have a live birth. So the rest, the 15%, actually, yun na nga hindi matutuloy doon. So let's not think it's the end of the world if you have one miscarriage. Now, it's a different story if you've had 2 or 3 miscarriages. Definitely, after 2 miscarriages, you have to be worked up.
Tapos may compatibility. May compatibility din pala yung minsan kahit walang problema, minsan kailangan talaga ng pag-alalay, ano?
Yun na nga yung tinatawag natin yung immunologic, Bernadette. Sometimes, as I said, is really overdiagnosed in this country. No, so it doesn't mean that just because you've had one miscarriage, it's an incompatibility problem. But in the Philippines, where everything is out of pocket, healthcare is at your discrepancy. You know, if you can afford the workup, you already go for the workup. So if it so happens after one miscarriage you were worked up, then so be it. No, we just have to respect that. But as I said, in countries where the government takes a great role in contributing to the healthcare of the people, they will have to follow yung protocols. Now, you have to have 2 miscarriages. 2 ka lang i-work up. Yung incompatibility in recurrent pregnancy loss only constitutes 5 to 14% of pregnancy losses. The great majority is unknown, Bernadette. And now we're finding out that a lot of it is genetic. So the majority is genetic. So number 1 is unknown, followed by genetic, and only 5 to 14% is immunologic.
Okay. Sige, Doc, we have 5 minutes left. Ano? So fine, nagkadalawang miscarriage ka na, 3. Anong next na option para mabuntis? O wala nang option? Ubus na ba yung option? Yun na yun? It stops there? O meron pa? Marami pang options.
You have to find out what the cause is and you get to the root of the problem. If the problem is anatomic, then you go to the anatomic problem. If the problem is, say there's a myoma that's getting in the way of the implantation, then you remove that myoma. If the problem is infection, you treat the infection. If the problem is genetic, then that's at the time. Well, if there is a genetic problem in either husband or wife, there's still a 60% chance that they will produce a normal child. So they have to be counseled. But there's also a higher chance for them to have another miscarriage. So again, you get to the root of the problem and you correct accordingly. Okay?
Oh, pero may mga choice ba yun? Kagaya na, ba nakikita natin may mga celebrities, I'm talking about surrogacy. Di ba nagpapabuntis? O yun, kaya yung iba naman, nagkumukuha dun sa mga sperm bank or egg bank. Option ba yun sa Pilipinas o wala tayong ganun? Bawal sa atin yun.
Alvin, we have no laws. No? So, hindi talaga bawal. Kaya lang, meron tayong Philippine Society of Reproductive Medicine which has given its guidelines, ethical guidelines, as to how far we can go with our practice. We're basically 85% Catholic. And so even if we do have IVF, and we now have about 8 or 9 IVF laboratories in the country, we still try to be as Catholic in our views so that we don't do third-party IVF. So that donor sperms, donor eggs, and gestational carrierhood so far are not allowed among all of us practitioners. And there are about 140 reproductive endocrinology and fertility specialists in the country. So hindi pa kami allowed. And wala pa.
Kaya pala lumalabas sila doon, kaya pumupunta sila sa
So,
Russia, o
kaya
sa
nga
Amerika.
yun.
US,
Kaya kami
Spain.
meron yung cross-border IVF. So, just an example, mitochondrial transfer. So, pag nalaman nila na ang problem sa'yo, kaya hindi ka makabuo ng baby kasi there's something wrong with your mitochondria, which is actually the powerhouse of the cell. This is so minute already, and it's not allowed in America. So, Americans will have to go to Ukraine, no? Where it's allowed. Kaya nga tinan mo na nagka-war, di ba? There's so many babies there that are left behind kasi nga, these are babies produced as a result of this extra IVF, more highfalutin IVF na to na hindi allowed in country. So, not everything is allowed in every country. So that
Ang
we
pwede
have
dito,
patients.
hanggang anong extent lang ang pwede po sa Pilipinas? Ang pwede sa atin, artificial insemination, pwede rin ng IVF.
Insemination and IVF, oo. And IVF using autologous cells. Ibig sabihin, sarili mong itlog, sariling similya ng asawa mo. So within the confines of the marriage. So outside of that one, hindi tayo allowed by the Philippine Society of Reproductive Medicine.
Oh, ganun pala yun. Napakahirap pala, Dok. Dok, sino yung babae sa likod mo? Ang ganda, oh. Kayo ba yan? Yung photo?
Yeah.
Ang ganda ng photo.
That's an old
Na-distract ako, Dok, eh. Oh, ganda-ganda ni Dok. Oh. Anyway, Dok, siguro last na lang, advice mo, Dok, sa ating mga kababayan, couples, na medyo nahihirapan and the options left for them. They badly need a child.
Okay,
At saka, Dok, siguro dahil tumatanda na yung mga babae bago should we freeze our eggs?
Yun. Okay, sige. So, sa akin, ito lang masasabi ko, no? Don't take too long. First of all, if you know that you already have polycystic ovary syndrome, if you've been diagnosed to have endometriosis, if you've been diagnosed to have ovarian cysts that needed surgery, huwag ka naman mag-aasawa kung 35 years old ka na o 40. Tapos piliin mo naman yung asawa mo na medyo fertile din. Ano? Mayroon ako may mga pasyente dyan, alam mo, inaalagaan mo, may endometriosis, tapos nung papapang asawa, wala pang similya. So, what I'm saying is do not delay your reproduction. It's not just because that you can achieve your career and all that. Careers will always be there. But our reproduction has its limits. Girls, you'll have to consider trying to get pregnant as soon as possible time. The number one reason kung bakit hindi tayo nagbubuntis ngayon is because we tend to take too long before we try to get pregnant. So do not postpone pregnancy. Do not postpone reproduction. Okay? Para mas makakatipid pa pati ng mabuti. And also, we have now egg freezing. Yes, it's a technology that's available, but it doesn't mean that just because it's available, you're going to postpone, no? Again, career is important, pero kung gusto mo magka-baby, unahin mo muna yung pagka-baby, and then the career will follow.
Kasi, Dok, paano kung hindi mo pakilala? Di ba?
Ayun na nga lang. Of course, it's an option nga for women who do not have partners. And yes, and of course they're doing well in their careers. Of course, it is a technology that we offer to women.
Yeah. Dok, yung sa mga lalaki at babae na bata pa sila, pero ayaw pa nilang anak. Di ba meron yan? Yung parang itago mo muna yung ko dyan, yung sperm ko dyan, at saka yung egg mo, i-bangko mo muna dyan. Meron sa ibang bansa nun, di ba?
Oo naman. Oo. Yung sa sperms kasi hindi masyadong problema eh. Kasi ang sperms can be very viable. And at age 40 yan, medyo bumabaksak na yung fertility ng lalaki and higher chance of miscarriage. But generally, ay mas okay sila kaysa sa mga babae. So for women, then you can do your egg freezing. Ages would be 25 to 35. That would be the best time, the most optimal time. Kasi nga, kung gawin mo later than that, syempre mas malaki na yung chance na abnormal na yung eggs mo, tapos hindi na ganun maraming eggs na ma-produce. Because if you want to go for egg freezing, you need to freeze about 16 to 20 eggs. And for women who already have a diminished ovarian reserve, hindi na ganun kaganda yung kanilang ovarian function, you might need 2 or 3 cycles in order to produce those 16 to 20 eggs.
Saan Doc ilalagak, i-store in the meantime? Meron ba tayo o sa ibang bansa?
Yes, we have all the IVF labs. So the IVF labs have the capacity to store those eggs. And in fact, we even talk about fertility preservation. Like say you have an endometriotic cyst or an ovarian cyst. And itong cyst na to kasi, usually it will recur. And so, pwede ka nang mag-freeze ng ovarian tissue mo, pwede ka mag-freeze ng eggs mo just before your surgery para hindi ka kasi nababawasan talaga yung ovarian function mo after surgery. So at least meron ka nang na-bank na eggs na you can use when you do decide that you're ready to have a baby.
And for how long can it be preserved? Can it be stored?
Indefinitely.
Oh, wow.
You don't want to use it when you're 50 years old and you can't walk or whatever. You know, you want to use it while you're capable of reproducing. Remember, as you get old, your eggs might be those of a 32-year-old or a 33-year-old. But like say you have it at 45 when you have myomas, you have a heart disease, you have diabetes. Siyempre, it's not a good time to achieve pregnancy. So the younger you are, the better. Yun.
No, but you'll never know. Baka in the future, magbago yung alam mo yun, yung maging maluwag tayo kagaya ng ibang bansa that egg or that sperm can also be used. Kasi ngayon may limitation tayo because of the moral and religious beliefs that we have.
Well, that's true. You know, our ethical guidelines will change depending syempre on the need of the majority. So, yun. We don't really know. I mean, things can change in 3 to 5 years, but as it is now, this is how it is.
Thank you, Doc. Maraming salamat, ha.
Thank you,
Doc. Sa
picture,
Doc, ha. Maraming salamat. Parang professor,
Thank
no?
you.
Para nakalibre tayo ng lecture.
Sobra.
Diba?
Thank you, Doc.
Salamat,
Anytime,
Doc.
anytime. Thank
Maraming
you.
salamat.
Bye. Thank you. Bye.
Dr. Eileen Manalo. Ayan. Thank you.
Ay
Maraming
nako,
salamat.
grabe. Close to my heart yung topic talaga, Vince. Si Dr. Manalo yung tumutulong sa akin.
Doktor mo ba si Manalo?
Oo, tinutulungan niya ako ngayon. So, actually, ang dami nila.
Parang nagli-lecture sa'yo palagi.
Parang ang ganyan ako ng ganyan, di ba? Totoo, don't wait too long. Kung tinatamaan po kayo, no? Don't wait too long. Kailangan ho nagpapa-check up tayo palagi when it comes to our health. Ano?
No, it takes two to tango. It really takes two to tango. Kahit gusto mo pa ako, partner mo ayaw, lalo yung mga lalaki at hindi nag-cooperate, ay hindi po. Kailangan para siyang joint project. Kayong dalawang may gusto. Hindi lang yung isa. Otherwise, wala eh. Hindi mabubuong project. Kailangan dalawa kayo. Go.
And it's 10:30. Sorry nga pala, tape nga pala episode natin. Oo nga pala, eto na mga kapamilya. Puntahan na po natin ang isang topic naman natin. Siyempre kung may reproductive health sa mga humans, abay dapat ang ating pets din. Ano? Paano nga ba mapapanatiling healthy ang ating pets? Si Lily. Ewan ko, tanong natin hanggang kailan ba dapat pinaparami ang lahi ni Lily. Eto't makakausap po natin, Dr. Ann Mirasol. Doc, magandang umaga po sa inyo.
Hello, good morning! Happy Sunday sa lahat!
Happy Sunday! Ay, taas ng energy nito. Okay naman gusto ko, mataas yan. Doc, taped episode ito, kaya mamomonitor mo yung sarili mo, Doc Marian. Ano po? So sa humans, may problema yung pagpapabuntis. Ano po? May mga nakararanas ng gano'n. Sa ating namang pets, ano po? When is the right time para mabuntis ang ating mga alagang hamon? Kung gusto ba natin?
Okay. First of all, I would like to say thank you, Alvin and Bernadette, for having me here. And also, para po sa mga pet lovers out there, para naman mabigyan natin sila ng mga points of view and recommendations paano i-maintain yung mga reproductive system ng alaga natin. So kung ano ba talaga yung mga reproductive health issues na kinakaharap ng mga alaga nating aso na hindi nagsasalita. So yun. So, very common. Basically, the top most common problem ng mga alaga nating aso, ito for almost 15 years in practice, ito yung mga napupuna ko. First, yung pyometra. Second, yung ovarian cyst. Meron din silang ganon. And breast tumor or breast cancer. Meron silang mga spraying behavior or urinary incontinence. then mga aggression, and also yung mga unwanted na mga pregnancies or reproduction. So, isa-isa nito, ito po yung mga factor na sinusubaybayan or mga talagang problema ng mga veterinaryo sa mga pasyente nating mga aso or cats. First, yung pyometra, ito po yung nagkakaroon po ng mga malodorous, seranginious, and mucopurulent vaginal discharges yung alaga natin. Meron pong dalawang klase ito, open type or closed type. So sa open type, nakikita natin na may mga lumalabas na mga nana. Sorry sa mga kumakain ngayon. So yun. And they will tend to have anorexia, inappetence, also depression, and pyrexic, may lagnat. Pero the other type is the closed type pyometra. Ito naman yung mas matindi-tindi at talagang delikado kasi often we can see our pet na lumalaki yung tiyan. Akala ng mga pet owners natin na buntis. Oo, pero hindi pala buntis. So when they bring their pet sa clinic and check by ultrasound or x-ray, walang laman. Nakikita po namin na puro fluid po ang nasa loob and mga pus. So with this kind of problem, ito po very fast dapat ang action natin, surgical intervention po talaga agad. So, secondary, yung sa ovarian cyst, this kind of problem is a liquid-filled lump na nasa ovary, no? And approximately less than 1 centimeter to approximately 10 centimeter ang diameter nito. So, ang problema naman, syempre, pag may ganito yung alaga natin, hindi sila kumakain, matamlay. So, pupunta yung mga pet owners, Doc, ngayon ko lang nakita yung alaga ko na ganito katamlay, ayaw kumain. Pero actually, matagal nang iniinda ng alaga niya. It is a kind of problem na hormonal imbalances ang problema na to. Thirdly, yes po.
Doc, bago mo ituloy, yung tanong ko muna is, paano malalaman ng pet owners na pwede na? Si Lily kasi magto 2 years old na, so nabuntis siya ng 1. So mga anong edad ba ideally pwedeng mabuntis ang iyong alaga?
Okay. Normally, yung alaga natin, they will hit the puberty period as early as 6 months. So, kung sa tao pa, nagdadalaga, nagbibinata. So, 6 months old. But, we don't recommend to let our dog, kumbaga, ipa-breed agad. So, sa age ni Lily, pwedeng-pwede na po. 2 years and a half na ata si Lily. So,
nanganak na po siya nung 1.
Okay. Pwede na yan. Pakawalan mo na yung dalaga mo. Okay. So, unang gagawin, syempre, dadalhin muna natin si Lily for check-up kasi meron tayong sinusundan na estrocycle. Itong estrocycle na yan, kukuha po kami ng vaginal cells through yung tinatawag natin na smear test. Sinisilip natin sa microscope yung cell ng alaga natin kung talagang ready na siya for stud. So, hindi lahat ng may menstruation na, baliktad kasi sa tao Kung sa tao nagdudugo or nagbi-bleeding, menstruation, hindi mabubuntis. Pero sa aso, kung saan yung menstruation, doon natin talaga babantayan, doon sila pwedeng mabuntis. Pero in the right time. So, kailangan natin yes po, yung progesterone content at saka yung level po kung ready na po yung mattress niya.
Okay.
May ultrasound rin ba yung mga aso?
Yes po, may ultrasound din po.
Tapos ito na, sinasadya, kasi alam ko po, kasi tungkol sa pagbubuntis ito, sa asong lalaki, may shooter yon. Di ba? May ginagawa minsan, may shooter. So, normally ba, ang mga aso rin ba, parang ilang % na kapag nag-intercourse ang dalawang alaga natin, ay makakabuo sila? Yung nag-lock na po, ha?
Oh, okay. Animal nature naman, they know what to do. So, but then,
What to do.
They know what to do. Hormonal, di ba? We do have what we call na domesticated na kasi yung mga alaga natin. Sometimes they really feel na baby sila. So, kung baby sila, hindi na natin sila na-expose outside, ayaw natin silang palapitan kung sinong mga pets dyan or dog dyan, especially kung female or male, sometimes male. So, hindi na sila na-expose. Pero once na naaamoy nila yung pheromones, itong pheromones na to, ito yung pinaka-powerful na smell or parang perfume ng mga aso, nagkakaroon sila ng urge. So, they eventually do that kind of thing, but sometimes because of height, kung masyadong maliit po si babae, malaki konti si lalaki, even though the same breed, hindi sila nagsisiabot. So, kailangan natin ng shooter. Tapos, kung si male pet natin, first time niya. So, syempre, hindi niya alam kung saan banda o shoot. So, kailangan niya ng guide ng shooter. Yun. Kaya kailangan ng shooter.
Kapag nag-lock, makakabuo ba agad sila or hindi naman necessarily?
Pag nag-lock, meron tayong approximately 48 to 72 hours na magta-travel yung sperm, tapos magkakaroon ng implantation. So, hindi agad-agad, pero within that day, like 3 to 4 days, yan, kailangan na natin siyang alagaan. Pero magka-count na tayo ng number. From the day of stud, 65 days, more or less.
Pero mataas yung chance pag hayop. Kasi sa taong baba pala, kahit na nag-sex sila, hindi rin pala necessarily makakabuo. Sa aso naman, mataas pala yung chance.
Mataas ang chance, pero kailangan pa rin ma-check. Yung motility ng sperm, parang tao din po, motility ng sperm, tsaka kung yung babae is nasa timing, kasi pwede pong mag-lock kahit na hindi po timing, lalo na pag may shooter. So, when we allow our pet to have it naturally, yun, malaki ang chance, 90% to 80%, naturally. Kasi meron nga silang sinisecrete na pheromones. But if we intervene, meron tayong shooter or mag-AI tayo, artificial insemination, it's very common for dogs. Meron po. So, kung hindi po napacheck si female, hindi siya mabubuo kasi hindi timing. Kailangan ita-timing talaga siya sa estro cycle nila.
The same is true sa pusa, Doc?
The same is true sa pusa. Yes po.
Oh, okay. Ngayon, kung hindi pa ready yung pet parent, kagaya niyan, si Lily, nagre-regla ngayon, pero parang ayoko pa kasi gusto kong palipasin ng isa pa ulit. Kasi nanganak na siya, di ba? Gusto ko another one more year. Balisa sila. Kasi siguro may naaamoy nga sila. Lalo na siguro yung lalaki, babae yung sa akin eh. Mas, di ba balisa sila, Doc? How do you deal with that?
Okay. Siyempre, ilayo mo. Nakakasakit ng ulo yan sa part ng lalaki. Frustrations. Oo, they're very frustrated. Tapos, yung babae naman, take note, sa time na nasa peak sila o nasa heat, tapos open kasi yung mattress eh. Sir Alvin, kung talagang gusto mo siyang ipastad or after a year, you need to really fix your mind na gusto mo pa ng for babies. Kasi if not, kailangan mo na siyang ipaspay. Kasi mas prone po sila sa mga tinatawag natin na mga breast cancer, pseudopregnancy, tsaka pyometra kung mag-iedad na sila ng mga 4 years and up habang tumatanda sila. So,
akala ko kapag nanganak ang alagang aso, hindi naman kakailanganing mag-spay, lalo na kung madalas naman siyang nanganganak. Diba kasi itong mga sakit na sinasabi na yung pyometra. Akala, ano ulit?
Pyometra po.
Pyometra, oo. Ang iniisip ko, dahil yan sa mga virgin na aso na mas prone, hindi rin pala.
Hindi siya guarantee. Nagkakaroon pa rin sila ng mga hormonal imbalances which leads to this kind of health issues.
Okay. So, kailangan
so dapat
rin
mag-decide na ako this year, partner. Kasi na si Lily, Tsaka almost 1 year na hindi siya nag-sex, So kailangan mag-decide na ako kung ipapaspay o hindi, Doc.
Yes. And it will also help Lily live a longer life.
Pag na-spay.
Pag na-spay siya.
Pero anong impact nun sa kanya, sa buhay niya?
controlling hormones, kasi as what I said, hormonal imbalances, ito po talaga ang pinaka main problem na nagkakaroon sila ng mga issues like pyometra, breast cancers, and mga aggression, spraying, or mga problema po sa renal na din po sa mga hormonal imbalances.
Oo.
Okay. Sige. So, kung gusto mo na maano yan, na mabuntis yan, kailan ka, maghanap ka ng stud, di ba? Siyempre, maghanap ka ng stud. And how do you look for that? Paano ba hinahanap yung mga ganyan na match? Or pwede bang crossbreed ang gawin mo?
They do have twice a year cycle. So every 6 months po sila nagsa-cycle. Hindi kagaya ng tao na monthly tayo may menstruation. For them, every 6 months, so once na they do have this kind of proestrous phase na nagsiswelling na yung vulva, tapos meron na pong menstruation, kailangan po alerto na tayo. Ipa-check na natin siya para po alam natin kung saan po natin ipapastad. Sa tanong nyo kung kailangan natin mag-standby ng partner, yes, parang tao din yan. Meron din silang crush. Siyempre, kung gusto nila, feel nila yung partner nila, then they will just give in. Pag ready na yung mattress nila. Kasi hormonal nga eh. But pag hindi nila gusto, awayin nila. So, meron din
ang galing, no? Mas simple sa animals. Di ba? Sila, napapakiramdaman nila agad yung katawan nila. Pag gusto ko na, maghaharap na sila ng lalaki. Parang ganun. Oo.
Tsaka hindi pala automatic, do. May type din sila.
May type din sila. Pero very important, we need to know the breed. Kasi hindi pwedeng si Chihuahua, ipastad natin kay German Shepherd.
Ano ba?
Layo naman. Ang laki naman nun,
Hindi sila magsiabot ang kawawa ang babae kung ang babae is the small breed. Kaya kailangan po match.
Wait, I have a question. Kunwari may big breed at may small breed, small breed si female. Pwede siya talagang mabuntis. Tapos paano yung pagbubuntis niya? Yung health, siguro pwedeng i-tackle natin yan. Yung puppy health. Pwede bang delikado rin for the mother? Or
Okay.
too big yung kanilang puppy? May ganun ba?
There will be two issues here. If the female is the large breed, then there is not much problem. Kasi kaya niya i-carry sa mattress niya, yung puppy. But if the female is small breed, doon tayo magkaka-issue ngayon. Kasi hindi kaya ng mattress niya i-handle ang pregnancy. Malaki masyado ang tuta, ang fetus mismo.
Pwede pala lumaki yung puppy doon kahit na, oh my goodness, so anong gagawin?
Pero wag naman, weird naman yun, di ba? Parang weird naman na ang laki ng aso mo isa, di ba, partner?
Hindi, paano nga kung nakatalikod ka, nakalusot?
Hindi nga abot yun eh. Kailangan mo nga ng assisted dun eh, di ba, Doc? Kailangan mo ng shooter dun pag gano'n, hindi siya abot. Hindi abot.
Hindi talaga pwede. Okay.
So, ibig sabihin, may role yung humans dun kung mabuntis mo yun, di ba?
Exactly.
Yeah, okay.
So one of the reasons also na hindi ina-accept ng Philippine International Canine Club or PICC, yung PCCI, yung documentation kung parang birth certificate nila to eh, kung hindi sila line ng breed nila.
Okay. Now, na-preggy na yung alaga mo. How do you take care of pregnant dogs or cats? May specialized pa yan na pag-aalaga. More food or less food? At ilang buwan sila bago manganak?
Okay. In the event na buntis na nga, confirm na with the ultrasound, kasi kailangan natin magpa-ultrasound as early as 35 days para klarong-klaro talaga. Though we do have pregnancy test kit also for dogs. So pwede silang matest as early as 21 days. Yon. So confirm na po, we need to take care of the diet. First, the diet. From adult dog food, kasi adult na nga sila, we need to shift into puppy dog food. So the difference is the crude protein content. Kailangan nating taasan ang protein content na pagkain nila. Kasi they need to nourish yung paglaki ng mga fetus o yung puppy nila sa loob. Second, syempre supplementation. We need to give proper supplement, yung mga OB, backup na mga vitamins, and immune boosters. Yun. Then third, less stress. huwag masyadong stress kasi pwede silang makunan. Lalo na pag ipapatakbo-takbo. So, natatakbo sila. Then, itong mga sinasabi na, Doc, hindi daw pwedeng paliguan yung aso ko kasi buntis. Actually, pwede naman. Pwede naman sila paliguan. Yun nga lang, ina-advise lang namin na kung pwede less stress, doon tayo papasok sa less stress. So, kung papaliguan natin sa alaga natin, syempre lalo na pag very dense ang fur, binoblower sila masyadong malakas yung blower. Doon sila na-stress, pwede silang makunan.
Oh, no.
Ang pagkain, Doc, kung dati twice a day, pag buntis, gagawin na bang 3 times a day? Or okay lang yan, twice a day pa rin, more food lang?
No, we don't recommend more food 2 times a day. We recommend small frequent feeding. Lalo na pag lumalaki na yung na hindi nila kayang i-digest lahat kung 1 time ang pagkain. So, small frequent, pwedeng 3 to 5 times a day, paunti-unti, pero maraming beses. And
Tapos, sige, ilang buwan bago manganak ka? Kasi 9 months sa tao.
Gestation period po nila mga 62 days plus minus 2 or 5. So, pwedeng early, pwedeng meron sila
2 months
mag-exceed
lang.
2 to 5.
Oh, naalala ko yung 65. Si Lily, naalala ko yung 65 na days na pinabantayan ng doktor, ng vet sa akin. Oo. Kaya lang, unfortunately, namatay yung 2 babaeng anak ni Lily kasi hindi ko nga siya napantayan. So, ito na lang. Paano ba yun? Pag malapit na yung 65th day, siguro i-check-in na siya sa ospital para ma-assistihan talaga ng mga vets, no? Yung mga
Tama po,
professional.
exactly. So what we advise as early as magpapa-x-ray din tayo para mabilang kung ilan yung puppy. At makikita natin doon kung malaki yung bone ng puppy kasi nahihirapan silang i-ire. So, we can recommend cesarean section by that way. But before that, papa-progesterone test natin kasi pwedeng hindi siya nagso-show ng sign of labor, silent labor, manganganak na pala. Pumutok na yung panubigan, for example, green na yung discharge pero hindi pa rin siya umiire. So, mamamatay ang mami sa loob. So, first, I recommend progesterone test. Pag nasa level na po siya ng proper time, we can actually do cesarean section rather than papasuffer natin yung alaga natin na magle-labor, hindi niya mailabas kung malaki ang ulo ng tuta niya. And second, kailangan kung normal delivery naman at alam nating nanganganak siya ng normal, we will observe nagkakalkal, nagne-nesting sila, at may mga vaginal discharges. Then,
So, pwedeng cesarean. Parang tao pala, no? Di mas mahal din yung cesarean kaysa sa normal delivery, to.
Exactly. Meron tayong ginagamit na gas-anesthesia, then mga gamot, nakaswero sila, naka-ICU din sila.
Grabe. Ako nakakatensa, no? Dahil may certain breed. May certain breed ba na CS lang sila? Or small breeds ba? Ay mas lang, normal lang ba? Ganun ba?
Very common po sa small breed na nasi-CS sila, but it's not actually 100%. But for large breed, nagno-normal din. Common sila na nagno-normal, pero hindi din 100% na normal. Depende sa position ng puppy sa loob.
Ay, question. Nasa breed ba yung dami ng puppies? Yung like yung mga big dogs, baka tagi-isa lang? Ganun ba yun?
Big dogs really give many puppies. Depende kasi malaki yung nila pagsidlan or the mattress, yung uterus nila. Malapad or malaki, mataas. So, pwedeng maka-cater ng maraming puppies. Pero hindi din ibig sabihin na malaking breed ito, marami itong mga anak, nagdidepende pa rin po sa timing ng implantation or sa timing ng stud. Kaya kailangan pa rin ng test or vaginal smear or ng progesterone test.
On the average, ilan?
Sige,
sorry.
Sige, go.
Ang average na nabubuntis ang mga aso? Ilang puppies?
Okay, for large breed, 6 to 8 or even as maximum of 14, depende sa number of teats.
Wow.
Parang biik.
Malaking breed, Pag small breed, 2 puppies, very average, but they will go to as high as 4. But basically, also 1. Kung mga masyado talagang maliit like Chihuahua. Pero very, average na po yung 2.
Si Lily had 5.
Ba?
Jack Russell naman siya. Hindi naman siya small. She is a Jack Russell.
Jack Russell, between small and medium. Pero sa small breed pa rin
Yes.
siya nagbilang po, sir.
Oo. So, dalawa yung namatay. Ikaw, Doc, anong alaga mo?
I do have my Rottweiler, Pomeranian.
Rottweiler!
Patingin.
Patingin
Tingin
na.
nga, wala pa
Doc, yung Rottweiler mo.
Okay, I'm gonna get Ruru. I do have 3 Rottweilers. Si Hiro at Mira.
Nagulat ako kay Doc, Rottweiler.
Oo nga,
Nasa
partner,
loob ba yung Rottweiler ninyo?
Rottweiler ang choice niya. Bakit Rottweiler, Doc?
They're very loving, especially for the kids. I do have 2 kids. So, Shikina and Wasil. And they're good with children, for kids.
Hindi ba nakakatakot, Doc? Yung Rottweiler nakakatakot sa kids?
Ay, puppy pa to eh. Maliit to.
Papi pa
cute.
to!
Hello! Anong pangalan, Doc?
This is Ruru.
Ruru!
Oh,
Yes!
Ayan,
3 months pa lang po to. Hello, Lily!
Oo, ang liit eh, no? Pag lumaki yan, di na yan pwede sa lap mo, Doc. Laki.
Oo.
Yung
So,
parents
Doc-
niya, nandun na sa likod kasi hindi talaga kayang i-handle ang kakulitan.
Oo. Doc, hindi ka natatakot, Doc. Di ba sabi nila yung Rottweiler, parang nakakatakot naman yan. Napaka-aggressive.
Hindi naman po. Depende po sa pag-train natin sa kanila. They're very lovely.
And very, very loyal, and protective.
Yes po.
Hindi ko kaya ang Rottweiler.
Ang ganda ng itsura ni Ruru, partner.
Eh, Ruru, pag ganyan kaliit, kaya kong alagaan. Pag lumaki na siya, hindi ko na siya kaya alagaan.
Lalaki talaga kasi yung Rottweiler.
Oo.
Diba? Oo.
Oo.
So, ilang praso yung Rottweiler mo, Doc? Doc?
3.
4 na?
We get
3.
3. Pang-tatlo siya.
So, sa mga nanonood sa atin na may bata, ayan, si Doc na mismo, vet po yan. Sinasabi ni Doc, safe yan sa babies, safe yan sa children. Doc?
Yes. They're very safe. They're very, masyado silang, alam nila kung sinong masters nila.
Galing Anyway, sige Doc, dyan lang siya wag mong tanggalin si Ruro para ikaw lang yung may pet sa amin dyan. Nakakatuwa po. Oo. Doc, kung merong, nabanggit mo kasi kanina, pwedeng magkaroon ng cancer yung mga alaga natin. That is also part of the reproductive system nila. So, cancer of the breast and cancer of the mattress? Did you say?
Ovarian cancer.
Ovary.
Yes, po.
Oo. So, how do you deal with that? Pag sa kanila, siyempre wala na sigurong chemo dyan. Paano mamamatay na lang sila, Doc, pag may cancer sila?
We do perform chemotherapy for pets.
Meron?
Meron po. We will send out a sample for biopsy para po ma-confirm kung what type of cancer, whether it is malignant or benign, para alam natin kung saan natin, anong start natin for treatment. So, but in order, still prevention is better than cure. So before, mapiprevent siya we just need to do spaying and castration, neutering. Sa pet natin, we need to make sure na alam natin kung ano ang gagawin natin sa mga alaga natin, whether we will breed them or we will just keep them as is na hindi sila magbubuntis o hindi sila mag-stud kung sa lalaki. So, we need to really snip. Kumbaga, tanggalin na yung mattress para yung hormone mag-tone down tsaka tanggalin na yung itlog.
So yung sa'yo na-spay na yan, na-neuter na?
Bata pa to, 3 months old.
Hindi, yung dalawa mo.
Yung dalawa, gusto ko pa ng puppy, Sir Alvin, kaya hindi pa po.
Okay. So saka na lang magde-decide si Doc.
Yes.
Ano po?
Pag meron
Yung
pa
breast
ako-
cancer, Doc. Doc, yung breast cancer, paano niyan? Treatment niyan?
Okay, for breast cancer, the same thing. We can tone down the hormone by doing spaying still and kasi rarely meron din kahit na male, nagkakaroon din sila ng breast tumor or cancer. So we need to castrate them as well.
Okay.
So,
Anyway, Ate B, may tanong ka pa kay Doc o magpapabay?
Okay na ako, Vin. Okay na.
Doc, pinaka-reminder niyo, Doc, sa lahat na nanonood po sa atin when it comes to the reproductive health ng kanilang pets. Bye-bye, Ruru. Go, Doc.
okay, how to keep your pet healthy? Let's provide our pet with good diet, fresh water, clean beddings, and also keep all the vaccination, deworming, updated, and give some anti-tick and flea para hindi po sila magkakasakit. So,
Yes.
lang po, and spay and neuter. consider that
Okay.
one.
And if they are in heat, anong advice mo? Ayaw mo silang pakasta, but they are in heat. Anong gagawin?
If they're in heat and ayaw nyo ipakasta, visit your vet and kumbaga kailangan na nating i-schedule for spaying and castration. Kasi ayaw nyo ipakasta eh. So you don't want any puppies at all. So paputol na natin yung mga mattress nila tsaka testicles.
Thank you. Doc, maraming salamat. So ulitin natin to, hanap tayo ng ibang topic na naman ulit ha. Nasaan po yung clinic niyo, Doc?
Okay, visit our clinic, Pet Family Animal Clinic and Grooming Center sa Imus, Cavite, and First United Doctors Veterinary Hospital in Dasmariñas, Cavite. Okay, always remember, pets are family.
Of
Bye.
course.
Thanks,
Thank you,
Doc.
Doc. Ayan. Thank you. Maraming
Bye,
salamat.
Ruru.
Oo. Parang di pa ako ready sa Rottweiler. Hanggang Labrador lang muna.
Alam mo,
Si
Vin.
Doc, natakot. Okay. Thank you, Ate B. Maraming salamat. Thank you for joining us today. This is a taped episode. Sorry po, hindi natin natanong ang gusto nyo na tanong. But hopefully, naitanong na rin namin kanina. Si Alvin Elchico po ito.
At ako po yung Ate B, Bernadette Sembrano-Aguinaldo. I-share po ninyo ang episode natin. I-like ninyo. Shout out sa mga taga-TFC. 8:30 po tayo palagi on Kumu, YouTube, and Facebook dito po sa Philippines. So, every Sunday po ito. Sa TFC, hindi ko po alam yung oras, pero pwede niyo pong i-replay ng i-replay. Ano? Bye! Until next time, dito pa rin sa Thank you, Doc!
Thank you, Doc. Bye.